Hi class, this is a PowerPoint presentation to go over the case studies at the end of chapter 13, which are in the format of operative reports. This is a presentation focused on the coding process to address some of the questions coming from your feedback regarding the selection and determination of a root operation and how you determine that based on the clinical information, which was the primary focus of most of the recent feedback since lesson 8 of this course. So this is chapter 13, which is on the endocrine and lymphatic system. And chapter 13 is part of lesson 12 of this course. So the first operative report is focused on removing a patient's left thyroid lobe. It's important that you look at the clinical information above the body of the operative report. So you look at the information next to the operation line, which says left thyroid lobectomy. And then you also read the information under the description of the procedure, because you're looking for the surgical approach and if any devices are left in the patient at the end of the surgery. It states in the clinical documentation a previous low collar incision had been marked, the incision was made, and flaps were elevated, gently elevating off the massively enlarged left thyroid lobe. So based on the fact that the physician cut into the patient to get to the thyroid gland, and we know anatomically the location of the thyroid gland, this would equate to an open surgical approach. It also goes on to mention in the operative report that a biopsy was taken and examined, and that also relates back to the diagnostic information that was given to us. The pre-op diagnosis was identified as a unilateral non-toxic goiter, and then we have a post-operative diagnosis that is different. And it states that the gland was delivered further up onto the ventral surface of the trachea. The connections were clamped, cut, and tied. A running 3.0 chromatic stitch was placed across the junction of the right thyroid and the isthmus. So this patient's left thyroid gland was removed, and anatomically, when the surgeon is looking down at the patient, it would be the right side to the surgeon. So if we're looking down onto the patient, this is the gland that they removed. He's talking about tying off this area at the bottom here. So they're just removing one side of the patient's thyroid. It also then goes on to state that a small Jackson-Pratt drain was placed. Another way to document that is a JP drain. We also have to look at or remember back in chapter 1 of the textbook, it stated that incidental drains are not reflected. So in this case, there was a device left in the patient. A Jackson-Pratt drain was put in to drain out some of the fluid that may have come because of the surgery in terms of the tissues around the neck, the soft tissues of the neck. But that is considered an incidental drain and is not going to be reflected as a positive value in our final ICD-10 PCS code. So we have the surgical approach, which is open. The drain is there, but we're not going to necessarily reflect it because it's considered incidental. And we also know that this patient had a biopsy because they were looking to see if this was cancerous or what type of disease process was going on with this patient's thyroid. It states that at the top of the operative report. And we know per ICD-10 PCS guideline B3.4 that we do code both the biopsy and the resection, or the biopsy of the thyroid and then the removal of the total left thyroid. We also know per ICD-10 PCS view that the thyroid gland is two separate body parts. The right is one body part, right side of the lobe of the gland, and the left is another separate body part. So we know all of that, and we begin our coding process. So we're coding the biopsy first. In terms of hierarchy in which code you code first. There is no definitive information yet. So you could code them in either order. You could code the resection first and then the excision, or you could code the excision and then the resection. Most coders probably would code the excision and the resection and code it in the order it happened in the surgical operating room. So we code the biopsy first. The main term is excision. And then we have the anatomy, which is thyroid gland and then left lobe. We're given the information of 0GBG in the table, in the index. Then we move to the 0GB table. We decided that the surgical approach is open via the information on the incision. No device, because there is actually no ability to reflect that. And then there is the fact that this was diagnostic. The biopsy itself, the word biopsy being used, equates to a diagnostic procedure. So we choose X as our final character value. And our final code for the biopsy is 0GBG0ZX. Then we could move to the coding of the thyroid gland, of the removal of the left lobe of the thyroid gland. So again, we have to understand that in ICD-10 PCS, the lobes, there's two lobes, there's a right and a left lobe. The individual lobes are considered individual body parts. So the removal of the entire left thyroid lobe in this case is considered resection. We index the main term of resection, then the thyroid gland, left lobe. We're given 0GTG in the alpha index. We move to the 0GT table. Our approach is still open, so it's 0. We do not code the JP drain, and we have only one option for qualifier, which is Z. So our final code is 0GTG0ZZ, and the root operation for this particular removal of the thyroid lobe on the left is resection. Operative report number 2 is part of your assignment later in this course, so we'll not go over that specifically. But going through all of these should help you in your coding of operative report number 2. The next one is operative report number 3. It states in the clinical information that patient's having a laparoscopic left adrenalectomy. We read the description in the first paragraph. Under description of procedure, it states that the patient had, that the physician used trocars, which is part of the laparoscopic procedure or part of the event. And then at the very end of the first paragraph, it says, under direct visualization, we placed a medial 5.0 millimeter trocar and two 5.0 millimeter trocars more laterally to our initial access site. So trocars are elements of the laparoscopic. They're components of using or doing this procedure laparoscopically. So we're confirming the information above that states laparoscopic left adrenalectomy in the operative note. It also documents that the physician is working on the left side of the patient's body. He refers to, or the physician refers to, the left colon. He also then refers to dissecting the adrenal gland off its bed. He placed the gland into an impermeable entrapment sac and he removed it through the initial access site. So we are confirming that the entire left adrenal gland on this particular patient was removed. And anatomically, this is a picture. Again, if we're looking down at a patient, we would be looking at the right side from our view as a surgeon, and that would be the left side of the patient. So the physician is taking off this organ here. So again, from an ICD-10 PCS view, the left adrenal gland is one body part. The right adrenal gland is a separate body part. So the physician removed the entire left adrenal gland, and that equates to the root operation of resection. So we move to the index. Resection is the main term. Gland is our next subterm, and then adrenal, and then left. We're given the code, or part of the code, in the alpha index, which is 0GT2. Then we move to the 0GT table. This was done via a laparoscopic procedure, which is an endoscopic procedure, and that equates to surgical approach selection 4, which is percutaneous endoscopic. There was no device left in the patient at the end of the surgery, and there's no qualifier. So our code for the left laparoscopic adrenalectomy is 0GT24ZZ. Then moving to operative report number 4, this patient had 3 specific components done. The patient had a bronchoscopy. Then the patient had 2 biopsies. The patient had a transbronchial biopsy of the mediastinal lymph nodes and then an excisional biopsy of the superior mediastinal lymph nodes. And that's coming from the procedure performed area of the operative report. A bronchoscopy is an endoscopic procedure using an endoscopic device. Then the patient had a biopsy where the physician used a needle. It states in the operative report a transbronchial needle biopsy was taken. Then the patient had a second biopsy. It also states about the fact that the first biopsy came back positive, but it was difficult for the pathologist to decide between small cell carcinoma and non-small cell. For this reason, she requested that we get an actual biopsy of lymph nodes. So that's why they did the second biopsy. They did the second biopsy via an incision. So that changes the surgical approach. The second biopsy is going to be an open surgical approach, which is different from the first biopsy. So again, when we move to coding this, we're thinking about order of codes. You definitely can code it in various ways. You can code the bronchoscopy first, but if we code it in the way, we code the biopsy first, so we code the first biopsy, which was the one that was via the transbronchial needle. We're going to index the main term of excision, and again, it was a lymphatic lymph. They're biopsying lymph nodes. It says transbronchial biopsy of mediastinal lymph nodes. So we're going to do excision, then lymphatic. The location is the thorax or the chest of the patient. We're given 07B7 in the alpha index. We move to that table. Again, it was a transbronchial needle, which equates, if we look back at chapter 1, that is a percutaneous, not a percutaneous endoscopic, because he was doing endoscopy, but he also then inserted a needle. So this is just percutaneous. That value is 3. There's only one option under device, which is Z, and then the last character value is X because this was diagnostic in nature. The code for the transbronchial biopsy of the lymph nodes of this patient is 07B73ZX. Then if we move to the second biopsy, again, the surgical approach is different because they made an incision. It states that the patient was prepped and draped in a normal sterile fashion. An incision was made. So that is an open procedure. We're going to index the main term of excision. It's still a biopsy. The main term is still excision, or the root operation is still excision. Then thorax. Then we have 07B7 given to us in the alpha. We move to the 07B table. We choose 0 for our surgical approach for open. We have Z for no device and X for our final character because, again, it's still a biopsy. It's just a different surgical approach. So the code for the biopsy open of the paratracheal lymph nodes, 07B70ZX. Then we have the bronchoscopy. It's helpful if you understand what a bronchoscopy is. You can index, in this particular case, you can index the term bronchoscopy and you're given the complete code, which is correct. But again, I do recommend that you index by using the root operation term. So the root operation for a bronchoscopy is an inspection, because a bronchoscopy, by definition, is a viewing of the respiratory structures. Specifically, the larynx, the trachea, and the bronchi and the bronchioles. So if we go with the alternative indexing method, which is the word inspection, and then we would have to know what is being inspected. So the terminology for that particular part of anatomy is the tracheobronchial tree. The approach is endoscopic, which is 8 at our table. And then we end up with the same code we would get if we look up the word bronchoscopy and the alpha index, which is 0BJ08ZZ. So for this particular operation, noted as number 4, there's 3 codes. There's 1 code for the bronchoscopy and 2 codes for the biopsies. 1 biopsy is via percutaneous approach and 1 biopsy is via open. Operative report number 5 is a bone marrow aspiration procedure. It's helpful again if you refer back to your chapter 13 information. It identifies for you that a bone marrow sampling or bone marrow obtaining it from the patient's body is considered a pulling out or a stripping out. So it equates to the root operation of extraction. You also need to know the location that it's being taken from. In this case, it states in the operative report, bone marrow biopsy sample obtained from the right posterior iliac crest. So we have the location and we have the root operation. The indexing is extraction, then bone marrow, then iliac. And we're given 07DR in the alpha. We move to the 07D table. Again, they're using a needle as noted in this graphical picture, and the needle insertion is considered percutaneous. They're making a small puncture. 3 is then the surgical approach, no device, and again, it is a diagnostic procedure. This patient is being evaluated, and the bone marrow sample, it says biopsy sample in the clinical information. That word biopsy is key, and that equates to an X. Our final code is 07DR3ZX. Moving to the next one, operative report number 6. Per the clinical information, this patient is having a problem with their pyloric stenosis. They're having projectile vomiting, and that is important information because that equates to giving us a clue to our root operation. Additionally, this patient has an excision of a thrombosed accessory spleen. So if we look at the clinical diagnostic information, again, this patient has a pyloric stenosis. A stenosis is a narrowing of the particular area of the stomach. So this patient is going to have what's called a pyloromyotomy, which is going to open up that narrowing pylorus. And that opening up equates to the root operation of dilation. So our indexing is dilation, then stomach, and then pylorus. And we're given the information of 0D77 in the alpha index. We then move to our surgical approach. This was done laparoscopically, which is an endoscopic procedure. We choose 4. There's no device left in the patient because they're going to open this up, but then they're not going to leave anything in there. If they leave something in there, then the patient will not be able to process food through their stomach and into their duodenum. So we don't want to leave anything in that area. We want to open it up, but we anatomically don't want to put anything in there. And then they checked it by putting air through the stomach. It says 40 cc's of air was inflated into the stomach. This revealed no evidence of a mucosal perforation. The stomach was then decompressed. So after they opened it using the pyloric spreader, they checked that the area was wider. And that equates to no device and no qualifier. The final code for the laparoscopic polymyrotomy is 0D774ZZ. And additionally, above that information, it states the patient was found to have what was called an accessory spleen. It states that examination revealed a 1 centimeter by 2 centimeter dark purplish mass attached to the omentum near the spleen. This was separate from the spleen. He had a normal appearing lobulized spleen in the left upper quadrant. This mass was consistent with the thrombosed accessory spleen. This was dissected free using electrocautery. So this accessory spleen is part of the spleen. It's not the entire spleen, it's an accessory, like an extra area of spleen. In this case, it's also thrombosed. So because it was just a part of the spleen, it wasn't the entire spleen, the root operation is excision, because only this mass or this accessory was being removed. So we index the word excision, then spleen. We're given 07B as in boy, then P as in Paul. The way that this was done was via the laparoscope. All of this work was done via the laparoscope. It states that the laparoscope, the endo-catchback was then introduced and used to retrieve the splenic lesion without spillage or contamination. So the surgical approach is laparoscopic, endoscopic, percutaneous, no device, no qualifier. The final code for the removal of the accessory spleen is 07B, P as in Paul, 4ZZ. Operative report number 7 is similar in terms of the same surgical approach, same anatomical area, but in this case, the entire spleen is being removed. So this patient is having a laparoscopic splenectomy. The patient has thrombocytopenia purpurea. So they're taking out the entire spleen. The spleen was placed in a bag, intact, and then removed. So the root operation in this case, because the entire organ was being removed, is resection. We index the main term of resection, and in spleen we get the code, partial code of 07TP. Again, this was done via laparoscopic, and these are the trocars I was talking about earlier. They make 3 small incisions and place 3 devices for stabilization. In this case, the trocars are stabilization, and they're also giving a view. There's a camera attached, so they're getting multiple views of the area inside the body without cutting straight down into the abdomen. So we code, or we choose 4 for our laparoscopic approach, surgical approach. No device, no qualifier. This was not a diagnostic event. They knew this patient had this disease process, and they knew they were going to go in and get this patient's spleen out. The final code for the laparoscopic splenectomy, which is removal of the total spleen, in this case is 07TP4ZZ. And then our last one is similar to the earlier one. This is another bone marrow aspiration or bone marrow biopsy. It's a different anatomical location, however. In this case, the patient's having it done of the sternum or the sternal area. But again, it's the same idea. They're taking bone marrow to make a diagnosis. This patient has anemia. They want to find out if the patient has leukemia, for example, or some other blood disorder versus just the symptom of anemia. So the indexing is extraction, bone marrow, then sternum. We're given 07DQ in the alpha. We move to the 07D table. The surgical approach in this case is open because it says a skin incision was made. They're going through, in this case, they're going through the front. This is the iliac location. This is a sternal. So they're cutting in through to get to the sternum. In this case, so they're cutting in, and it says skin incision. So that makes an open surgical approach. So we choose 0. There's no device, and X is our qualifier because this is diagnostic. It's a bone marrow extraction, or bone marrow sampling, or bone marrow biopsy. Our final code is 07DQ0ZX. Also, please note all of your alpha characters are in uppercase. None of them are in lowercase. So make sure you're paying attention to that in your typing of your ICD-10 PCS codes. If you have any questions on this presentation or the thought process of determining the root operations, please email me in Canvas or post to the related forum area.